for the female clients? What is it called?
Action.
Not lithotomy. Lithotomy is with the stirrups.
Oh, yeah.
What position is?
Dorsal
recumbent is where the knees are up, and then you flop them. You flex them out to the sides, so you have a working space. All right, and then I'm going to start. I could wash my hands if I needed to again, and then I'm going to open my sterile kit, and I'm going to use this bag for all my trash. So it's nice and handy. You just want to make sure wherever you position it, you're not going to bring your dirty materials over your sterile field. So think about, I'm going to set my sterile field here on the bed, and I don't want to pass over my sterile field with my dirty supplies to get to my bag. And so for me, my preference is to put my bag right here, so that way when I clean my client, I can cross over here and dispose of my sterile rather than going back over my sterile field. You can put it over here, but you would have to make sure after you clean that you would pull your dirty back towards you, but not touch yourself, and then way over here. So this is the best position in my opinion. All right, I'm going to remove my content label, and then I'm going to set up my bag right here. Your first time when you open up your sterile kit, you need to open it away or towards you first? Away from you. So I need to turn it like this, and oh, it's tucked in pretty good. Pull it away as much as possible, and then you do side. I'm just trying to make sure that we don't touch much. Side, and then finally towards you is your last step. Okay, and it's not laying down totally flat. I can touch my 1-inch perimeter if I would like and flatten it out more. Just make sure that you don't touch within that 1 inch. Okay. All right. Next part, you see my gloves are next. I'm going to grab my package and I'm going to bring it over here to my bedside table, making sure I don't turn my back to my sterile field. I open it up. Which hand do I do I glove first? My dominant hand. Okay, and just make sure, like what I told you before, make sure you hold your hand up so that your fingertips don't touch the edge of your sterile field. Glove my non-dominant. Make sure your thumb is up when you're applying it. Okay, now we have our drapes. And since I have my gloves on sterilely, I can manipulate the inside contents of this however I would like. I have 2 drapes. I have one that is flat, and then I have one that's fenestrated. Okay, your flat one goes underneath the patient's pelvis, and the fenestrated one goes on top. So I'm going to use my flat one first. You see there's a shiny side and an absorbent side. Which side do you need on top? Your absorbent side. And I find the easiest way to do this with maintaining sterility, because if I touch the patient's skin with my gloves, what's going to happen to my gloves? I'm going to break sterile technique. So you see how I have it twirled up around my fingers? That ensures that I don't touch the patient's skin with my hands. So I'm going down, and I can ask them to lift up some if possible. Thank you, Megan. And then I can let go. All right? Now, you see how I'm forming a large sterile field right here. Next is my fenestrated drape. I can open it up and look at it, see what I'm working with, and I'm going to place it over the patient's perineal area. Next, I'm working with the contents of my box. I like to place my bag in back and then my cleaning contents in front. And like what we said previously, make sure that you test for check them for allergies. Make sure that they're not allergic to your cleaning solution. You would open this. This is they're like cotton tipped applicators that are dipped into the solution. You may either have these as swab sticks, or you may have cotton balls with an antiseptic that you pour over them with some forceps. Either way, you'll be cleaning the client. But I'm not going to open these because I can't actually clean the mannequin with this solution, or it will affect my mannequin's integrity. Your other components are, I have a syringe filled with sterile saline for my balloon. I can go ahead and connect it to my catheter. And you see when you pull this up, make sure that this doesn't hit any of your sterile field. And I can go ahead and pull this covering off of my catheter because I'm getting everything ready. And then I'm just going to kind of throw this over to the side, because if I try to stick in my trash bag, I'm going to break sterile technique by trying to shove my hand in there, right? And then I'm going to go ahead and connect the sterile water to my balloon port. But remember, according to the most recent evidence, you're not going to test your balloon at this part. You're just going to connect it. Okay, so I have that ready. I'm going to put my lubricant in the other part of the tray. And then I can, since this is sterile, I can drop over here, or I can come over here and drop it into my bag. Doesn't matter. And then I'm going to go ahead and lubricate my catheter and set it in my lubricant. With the female, I make sure I lubricate it how far? 1 to 2 inches, right? And then you insert 2 to 3. Yeah. Okay. So now at this point, I have my sterile field all set up. At this point, I'm going to break sterile technique or sterility with my non-dominant hand. And I'm going to go in and I'm going to open up the labia as far as I can until I can visualize the urinary meatus. And then using my 3 swab sticks, I'm going to clean 3 swipes, or if I have cotton balls, I would use them until they're gone. When you clean which part first? The outer, the part away from you. And so starting from top to bottom, clean away. Then I dispose of it in my trash. I grab my new one, top towards me, dispose in my trash, drop it. Make sure that you don't touch yourself with the sterile hand. Go back in, go straight down the middle. Okay? Dispose. Now I'm making sure that I don't move this hand, because if I move this hand, the labia will close back together, and then we broke sterile technique. If it was a man, you would hold the shaft of the penis, and then you would clean the head of the penis or the urinary meatus. You would use circular motions 3 times around the tip. Okay? But we're on the female, so we're going to go back to that. I have the labia spread. I have my catheter lubricated, 1 to 2 inches. I'm inserting how far? 2 to 3 inches. And make sure that your fingertips don't touch the patient's skin. And so you're inserting, and this catheter, this mannequin, I don't believe it goes in very far. So we're going to say at this point we got 2 to 3 inches. We're going a little bit more. We see urine return. After you see urine return, you go 1 inch further, and then you stop. At this point, you can use these 2. Your sterile technique is technically over at this part because you're in as far as you're going to go. Remember, if you have a male, you're going to insert until you get to the bifurcation part where this tube splits out. Okay, then I'm going to secure it with these 2 fingers. I'm going to let them drop down a little bit to make sure that that catheter, if they sneeze or cough something, it's going to pop right back out. So I'm holding it with my non-dominant hand, and then I'm going to inflate my balloon. Okay, however, I'm not going to inflate the balloon in the mannequin because the mannequin doesn't have enough room, and my balloon will pop inside the mannequin. Okay. So I'm saying I'm inflating it with the 10 cc's as the manufacturer recommended. And now I can disconnect, and then I can tug back till I feel a little bit of resistance. At this part, I'm pretty much done. I can go ahead and adhere it to the patient's thigh. With the female, you do the inner thigh. With the male, depending on their mobility status, you can either do the inner upper thigh, or you can do the abdomen. But you secure it. And typically with the securement devices, you secure it at the bifurcation to keep it from slipping or tugging out. And then you're going to hang your bag on the bed frame or the bed rail. The bed frame. Okay, and then as your bag will go ahead and start filling up at this time. And one important thing about the tubing is to make sure that you don't have any dependent kinks. And you can ensure that it's flat on the bed by using this nice little clip and clip it to the sheets. Okay. All right, so now let's go to removal. Okay. So let's say all this is cleaned up. I don't want to rip these supplies because this belongs to one of you. So we're going to just move this to the side for just a minute and pretend like this was already still in the urethra, right? And then I'm going to have my supplies ready. Oh, and one thing I forgot, after you insert the catheter, make sure that you clean the patient afterwards, because they're going to still have some of that betadine or iodine on them, or the lubricant. Make sure that they're clean and fresh after you get done as well. All right, so with removing the catheter, you're going to wash your hands, perform perineal care, and then don clean gloves. You don't need to be sterile at this point. You're going to have your supplies ready, which is a biohazard bag for your Foley catheter. Typically, I set it up on the bed so I can have it right where I need it. I'm also going to place a towel underneath the patient's perineal area, leading to your biohazard bag, because you may have a little bit of drainage when you pull it out. And I'm going to have me a graduated cylinder, which I'm going to go ahead and empty the Foley catheter into my graduated cylinder before I get started. Measure my output, assess for coca, dispose of it, okay? And then I'm going to put my catheter in my biohazard bag. I'm going to have my empty 10 cc syringe, but make sure that you are aware of how many cc's your balloon was inflated with first. Typically, your catheter will be labeled. This one says 5 to 10 milliliters. So I'm going to pull it out, and it should, once you start to pull some, the pressure should just fill the syringe, but this one balloon doesn't have any water in it for demonstration with the mannequin. But I'm going to pull out the 10 to the 10 mark, squirt it out, and then I'm going to, for good measure, I'll always double check and make sure I have all the fluid out, because some catheters have more than 10 cc's in it. Okay, so now that we have the catheter deflated, I'm going to count to 3 and tell the patient to bear down when I pull it out. All right, 1, 2, 3, bear down. Slip out the catheter. It should come out nice and easily. And I usually try to twirl it up in my hand, and then you dispose of it in your bag, and then you perform perineal care. One thing I didn't mention during insertion, and I apologize, is also tell the patient before you insert the catheter that you're going to do it. And when you insert, count to 3, ask them to bear down, and that'll help open up the urinary meatus as well to ease the insertion process. Okay? All right, thank you.
Thank you.